I'm excited to introduce Dr. Nereyada Sevilla to discuss the DHA J-9 Clinical Investigation Program. Dr. Sevilla is the acting chief for the Defense Health Agency Clinical Investigations Program. She expertly analyzes research protocols for technical, scientific, and fiscal content, fully implements the intramural call for proposals, and conducts site visits with respective directors and research investigators. Please welcome Dr. Nereyada Sevilla.
Greetings, DHA. I am Dr. Nereyada Sevilla and happy to be part of the annual Clinical Investigation Research Training Day, especially on your 50th anniversary. Congratulations. I'm currently the acting chief of the brand new Clinical Investigation Program Office at DHA. And even though we may be brand new, I am certainly not new to the Clinical Investigation Program. I am an aerospace physiologist by trade. I spent 10 years doing field physiology in the United States Air Force. And then in 2007, I moved up to the Air Force Surgeon General's Research and Development Department and been working R&D and clinical investigations to 2007. I also had the honor since 2011 to be the chief of the Air Force Clinical Investigation Program. When the DHA transformation stood up, I was asked to come over to DHA and help bring the 4 services, which is Army, Navy, Air Force, and the NCR, and all their clinical investigations under DHA. And so probably you've heard a lot of facts and rumors about what is this DHA transformation and what does it mean for you? What is going to happen when the MTFs go from their services to DHA? What is this DHA J-9 division? And what is this Clinical Investigation Program Office, or what we call the CIPO? And those are the things that I'm hopefully going to be here to help you alleviate those fears. Because bottom line, that we want this transformation to be completely transparent to the researcher. We have found that in going through all the clinical investigation programs, through all the services, everyone has a really good program. And we don't want to stop or cause any roadblocks in the research that you're currently doing, but we want to be here to help advocate and hopefully streamline processes in the future. But we certainly don't want to stop any research that's going on. We want you to continue to do the research that you're doing. We want to make your job easier. We want to streamline processes. We want to advocate for your position. And we're working with all the clinical investigation directors, the DCI chiefs, to get your research done. So that's what we're trying to do also at J-9. J-9 is the Research and Development Division of the Defense Health Agency. Essentially, it brings in all the DHP dollars, all the medical money into one location, and essentially bring in what are the health initiatives, what are those readiness requirements that require both R&D and O&M dollars. We have the money. You also have the facilities. You have the patient population. You see what's going on in your clinic. How can we merge this? And we find that it's very synergistic to have both the R&D and the clinical investigation, both under J-9, as well as other processes that help us streamline some of those research roadblocks that you may be experiencing. But we certainly want to be part of the entire continuum of research. What are those studies and analysis that you're seeing? What are some things that you're seeing in your clinic? Do you have those partnerships with research, academia, and industry? We certainly don't want research to be from bench to bookshelf. We want those to really impact the MHS. And what you'll hear us saying a lot is that we want the MHS to be a research teaching system. We want it to be that teaching system in which researchers and clinicians work hand in hand. And that in turn makes everyone a better clinician, makes the hospital a better hospital, and has better patient care for our beneficiaries. We want to be able to translate all those results into practical knowledge, products, and policy, and to really make us state of the art. And that is what our DHA SIP mission is all about. Many have heard that SIP is for GME, but we're more so than just GME. We're more so than just those scholarly activity. We want to facilitate any research and training to support graduate health science education. That is our docs, that is our nurses, that is our dentists, that is our physical therapists. Anybody who's considered healthcare providers working in that student status, working in the military health system to enhance that patient care, as well as get us ready to fight any war medically that we may come across. And so we have those partnerships. You have great partnerships down there at the local level, at the GME level. We want to continue to work with those program directors, making sure that you are accredited. Again, that teaching hospital system, and I can't say that enough. We want to ensure that we're doing our job to ensure that you have that scholarly activity available. We don't want any program written up for that lack of scholarly activity. We want to ensure that you have those opportunities. And down in San Antonio, you have great opportunities, both at the Wilford Hall and the Banksy facility, as well as the academic regions all around. We want to be able to collaborate, to partner. And what are some of those things that are preventing you from doing that? That's what our office is trying to do. We're not trying to establish any further policies, any further roadblocks, and you don't have to continue looking for what are they making me do now. Instead, ask us, how can we continue to help you? And this is what we see across all of the clinical investigation program sites. If we are going to be one MHS, one DHA, no longer Army, Navy, Air Force, NCR, you may be able to PCS from Portsmouth to Banksy, to Madigan, to Travis, and shouldn't have to relearn any research policies. And we certainly want to establish collaborations between all the medical centers. Right now, under the Clinical Investigation Program Office, we're supporting 17 sites. 17 sites that we're trying to baseline, trying to figure out what are your lessons learned? Actually, what are your best practices? The markets may not be up yet, but we are working together with the DCI chiefs, having monthly meetings, having quarterly meetings, to be able to establish what can we do together? What can we do right now as we establish the markets to be able to really do research across the entire MHS, not only within these 17 sites, but across all the clinics? And how can you reach out to your counterparts at other clinics or your counterparts are in academia? And that is what the Clinical Investigation Program Office is all about. So we have 5 functional areas that we have stood up, everything under DODI 6000.08, the Defense Health Program Research and Clinical Investigation Program. That was established in 2014, but the Clinical Investigation Program has been around a lot longer than that. But what they found out in 2014 is that the Defense Health Program and the research program it's part of the entire continuum. So they put it all together, all under J-9. And then in 2019, we finally established the DHA-PI 3200.02 clinical investigation programs in military treatment facilities in the MTFs. And what that does is doesn't add any more policy, doesn't add anything that you have to do. What it does is enhances our mission. It shows that we are an important part of what we have to offer to make this a teaching system, both with our R&D partners, our O&M partners, and any other color of money that you have. And so what are some things that we can provide to you? If we're truly a customer-based service, what can we do for you to help you out and your research? And those are some of those functions that we're trying to establish right now. One of them is contracting. You may have the grant, you may have found that you got this money, but now you can't spend it. What can you do now? Because the military has a whole bunch of new rules that you can't just go out and just partner very easily with your collaborations. There are lots of rules and regulations that we can help you out with. As an easy win, that we've established a centralized contracting partner with USAMRA to help you out with that contracting agency who are very experienced in military medicine and contracting. We also, within J-9 in our office, we have hired an expert in military medicine and clinical investigation contracting to be able to speak contracting with our contracting officer, as well as with you, to be that bridge of contracting expertise. We know that you are an expert in research. And how do you translate that to be able to put something on paper and be able to spend the money that you have? That's sort of things that we want to try to do. but we certainly don't want to be a roadblock. And what I mean by that is this is an option. This isn't a mother, may I, can I do this? If you already have a granting organization who has a partnership with a nonprofit or already has a mechanism and they are going to spend the money for you, great, go for it. You don't even have to tell us about it. But on the other hand, if you find yourself with this money and don't know how to spend it, come to us. That's where we can help you establish the paperwork so that you have all the processes in place. Secondly, on that, we have policy processes. What are some other policies and processes that may cause a roadblock in research? It could be the survey office. It could be the privacy office. It could be data sharing agreements. It could be the IRB. It could be the IACUC. What are some things that are you getting stuck and you don't know either who to talk to, or are you misinterpreting something, or just don't know how to fill out the paperwork? Let us help you out. Another easy win that we just had is that we have hired a data scientist to be able to help people gather some of that data research and those data elements from the MHS, something that may have been stuck in the privacy office or getting a data use agreement. So come to us through your director and your chief to say, can we have a little help, please? And those are the type of services that we can offer you. And so that is essentially the bridge that we provide. Essentially, we want to have everybody's working towards the same goal, improving the quality of healthcare in the military health system. We want to improve the readiness of all our soldiers and our airmen and our seamen, of everyone working in the military, as well as the beneficiaries, as well as kind of work out what are some things that we see to be state of the art. We want military medicine to be absolutely state of the art. And to be state of the art, we need to be a teaching system that contributes to the high professional standing of graduate health service education. And that's what we try to do. We are new, but we're working slowly and systematically so that we don't break your processes, but we provide better processes for you. So what's going on kind of overall in this current state? In this current state, business as usual. All the SIPs across all what was considered the services maintain the local operations until there is a DHA procedural instruction that supersedes it. If there isn't, then the service maintains their local policy and you keep your own local policy that works for you. All policy and funding stays the same. But as we slowly transition into DHA, and that's what we're trying to do, we're doing slowly, systematically, so nothing breaks. If we need to grandfather processes in, we will do that to ensure that you continue with the research that is currently going on. So that in the future state, now we could have those better collaborations between the SIPs. Across all the SIPs, if now we have standardized processes, now we can all work together because we're working on the same forms. And those are one of the things that we're trying to do, is standardize policies and procedures so that when you move from Portsmouth to BAMC and BAMC to Travis, you don't have to relearn any local processes. One of the first technical manuals that we're currently working on is on scientific review. And on scientific review, we just want to ensure that any research that's going on in the MTF is scientifically valid. We want all the commanders to be proud of the research that they're doing, not just for the MHS, but for medicine as a whole. But if you've already gone through a scientific review, you don't have to do it, such as the R&D processes already go through a very rigorous scientific review. You don't have to do anything secondary. This is to ensure everything goes through some sort of scientific review. 99% of all the clinical investigation programs have a scientific review. This just emphasizes the need to have a policy in place and to emphasize how well of processes some local researchers have going. Our second technical manual is our reimbursable manuals. And that is something that everybody's looking forward to because it really enhances the need for you not to do research out of hide. We know that the MTF commander don't want to ever say, I can't afford this research again. So If you're having something that is outside the standard of care, we want to ensure that the account is going towards that research account and not going against the hospital. And those are things that we're working with MHS Genesis, and to ensure that you're getting your fair share out of that granting process. Those policies are already in place with the DODI. We just want to emphasize it with our technical manual. And the more money you bring in, the more money that you'll be able to spend on infrastructure costs, research nurses, grant writing personnel, that in turn gets you more money. And the more money you get, the more your commander can really provide that support to ensure that research really goes on in their facility. And that continues that strong partnership with the graduate health science education, that unified effort of getting that teaching system, because that is something that we're all working on. And so that's what I want to leave you with, and my contact information. We are trying to all work together to make a better process. Some clinical investigation program facilities are more mature than others, and we are trying to establish processes that really help you out. I really encourage you to come to our website. Our website has a lot of successes. As you are doing some great job, we want to hear about them, and we want to put them up our chain of command. I know you're probably putting it up your chain of command, but I want to let our general know, our J-9 director, General Simonson, on things that you're doing, as well, as things that go on to general place. And what we're also trying to do is to find all those research funding opportunities to help your facility. The one that's currently open right now that closes on 15 April is the Advanced Medical Technology Initiative at Directorate. And BAMC has been very successful in getting some of that money. And that is O&M money for that bottom-up approach on technical innovations and any of those biomedical principles that may have technological barriers. You know what's going on in your facility. And those may be things like, that may be a good funding opportunity to help out your clinical investigation facility. One that we just closed out is the Military Health Systems Research. And that one was to help curb medical costs. What other MHS policies do we have out there? And so that's what our office is trying to do, to find these funding opportunities that are very military specific, that may be very also military MTF specific, to help you and your clinical investigation program standardize those processes and really increase our footprint across the entire MHS. Let us be a better resource for you. I appreciate your time. My door is always open. Thank you.